Hi everyone, my name is Dr. Waker, also known as Dr. Kiara, and I'm a psychiatry resident at the University of Saskatchewan in Canada. Today I'm here to talk about the Canadian residency pathway for IMGs. Canada is often considered one of the most difficult countries to match in as an IMG. Some even say it's nearly impossible. But while the pathway is competitive, it is certainly possible to match with the right strategy and preparation. So in this video, I'm going to talk about the step-by-step process for IMGs to pursue their residency in Canada. We'll cover eligibility requirements, key exams, broad timelines, and some important considerations before we start this journey. Firstly, it's important to understand how the Canadian residency training works. Canadian residencies can last anywhere between 2 to 7 years. Residency positions are filled through an online system known as CaRMS, or the Canadian Resident Matching Service. Applicants rank programs and programs rank applicants, and this system matches candidates based on an online algorithm. However, unlike some countries, Canada has a limited number of spots for immigrants, and that makes this process brutally competitive. Before applying, you need to make sure you meet the basic eligibility criteria. Generally speaking, you need to meet these basic requirements. 1. You must be a permanent resident or a citizen of Canada. 2. Have a medical degree from an accredited medical school listed in the World Directory of Medical Schools. And 3. Have your credentials verified through physiciansapply.ca. This includes creating your physiciansapply.ca account, submitting your medical degree, transcripts, and other documents for source verification, and obtaining your MINC, which stands for the Canadian Medical Identification Number, a unique lifetime number that is assigned to every physician and medical student across Canada. In addition, there are certain province-specific requirements. For example, some provinces require proof of residency, which means physical presence within that province for the purpose of application eligibility. Other provinces like Ontario require high school completion from within that province. For this purpose, it's important to check specific program requirements before applying to that program. Next, the exams. There are two main exams: the Medical Council of Canada Qualifying Examination Part 1, commonly called the MCCQE1, and the National Assessment Collaboration Exam. The MCCQE1 tests clinical knowledge, decision-making, and critical thinking skills. The NAC tests clinical skills in an OSCE-style patient encounters system. English language proficiency tests that are accepted by the MCC include the IELTS, OET, TOEFL, and CELPIP. Certain provinces, like Quebec, require French language proficiency tests. If applying to family medicine, you need to take an additional situational judgment test known as the FMPRO-C, which stands for Family Medicine Professional Choices Assessment. Some other provinces require other situational judgment tests like CASPER or British Columbia Clinical Assessment Program. Strong performance in these exams is important because they are used as screening tools in the application process. Once you've met the eligibility criteria and completed the required exams, you can now apply to CaRMS. Your application typically includes your exam score sheets, your CV, personal statements, medical school performance record or MSPR, letters of recommendation, and documentation of your clinical experiences. Many programs also value Canadian clinical experience, research experience, and volunteer work in Canada. Once applications are reviewed, selected candidates are invited for interviews. Interviews are often structured and may include multiple mini interview style questions, which focus on communication, ethics, and problem solving skills. Timelines can vary depending on individual factors. On an average, most IMGs spend somewhere around 1 to 3 years preparing for the process. A typical pathway or timeline may look like this. Year 1, credential verification, preparing for the MCCQE1 and the NAC OSCE. Year 2, gaining Canadian clinical exposure or research experience, preparing for tests such as FM Pro C or CASPER, and applying to CaRMS and attending interviews. Many candidates prefer to prepare for exams while working full-time or part-time. It is generally advisable to avoid long gaps in clinical practice, and many programs prefer applicants who have completed graduation within the previous 3 to 5 years. Planning ahead is important because some of the exam dates and application deadlines are fixed. Before starting this journey, there are a few important things to keep in mind. Firstly, the process requires time, financial planning, and persistence. Second, there are only a few limited IMG spots in Canada, which requires realistic and strategic planning. And finally, building a strong application goes beyond scores. Things like communication, professionalism, and clinical experience are equally important. To the IMGs considering this pathway, this journey may seem challenging, but with determination, planning, and the right guidance, it is certainly achievable. I hope this video helped you have a clear overview of the Canadian residency pathway, and I wish you all the best in your medical careers. Thank you for watching.